Obesity is a worldwide health crisis. The American healthcare system has struggled to combat this chronic disease. Prevalence, risk factors, pathophysiology, cultural considerations, health promotion, and prevention of obesity will be discussed. Obesity and overweight are terms often used interchangeably, but they are in fact different. Athletes may often be technically overweight due to the weight of their muscle mass, but they are not obese. Obesity can be defined as an excess amount of body fat when compared to lean body mass. There are degrees of obesity. Obesity is defined as a BMI from 30 to 40, while morbid obesity is a BMI greater than 40. Ideal body weight is another measure that can help to diagnose obesity. Obese people are usually 20% above their ideal body weight, while morbidly obese people are usually more than 100% above their ideal body weight. Obesity is a growing problem in the United States and globally. According to the most recent data from the CDC, approximately 36.5% of adults and 17% of youth in the United States are obese. These findings are on the rise. In 1999, only 30% of adults and 14% of youth were obese. In adults, the prevalence of obesity is higher in women at 38% compared to men at 34%. Non-Hispanic blacks have the highest prevalence at 48%, Hispanics second at 42.5%, non-Hispanic whites third at 34.5%, and non-Hispanic Asians last at 11.7%. The biggest risk factors for obesity are related to behavior and environment. Living a sedentary lifestyle is one of the largest risk factors. Currently, the CDC recommends adults perform at least 150 minutes of moderate intensity activity along with 2 days of strength training per week. Eating high-calorie foods with low nutritional value, along with large portion sizes, also puts a person at risk. Drinking juices and sodas instead of water is a risk factor. There are also many environmental risk factors. Living with family members who are obese increases the risk of developing obesity. People with poor socioeconomic status are at a higher risk. Working a sedentary job with obese coworkers can also increase the risk of obesity. Poor infrastructure has been linked to obesity. Examples include a lack of safe sidewalks or bike paths that would otherwise encourage physical activity. Genetics or family history are frequently blamed for obesity, but research shows that genetic changes occur much too slowly to account for the current obesity epidemic. Rarely will genes alone cause obesity. In fact, there have only been 78 reported cases of obesity caused purely by genetics worldwide. Finally, diseases or drugs can contribute to the development of obesity. Diseases such as Cushing's disease or polycystic ovary syndrome can cause obesity, and medications such as antidepressants or steroids can also contribute to obesity. The pathophysiology of obesity is extremely complex and involves many different factors. There are many chemicals in the body that affect metabolism and appetite control. For the sake of brevity, not all of these will be discussed. Some of the most important are two groups of neuropeptides known as orexins and anorexins. Orexins, put simply, are appetite stimulants. Ghrelin, sometimes known as the hunger hormone, is an example. This hormone makes a person feel hungry, and increased levels of ghrelin or other orexins can contribute to obesity. Anorexins are a group of chemicals that are appetite suppressants. Examples include leptin and insulin. When leptin levels rise, a person will no longer feel hungry. However, the body can become resistant to leptin, resulting in overeating and the development of obesity. Very rarely, a person can develop obesity purely from disorders related to the neuroendocrine system. These could be related to genetic defects, brain damage, or as complications from diseases such as Cushing's disease. It is important to remember, however, that obesity is preventable with behavior and lifestyle choices. Even if a person develops leptin resistance or other chemical imbalances, a healthy diet and regular physical activity will prevent a person from developing obesity in almost all cases. There are many complications associated with obesity. Obesity affects every body system. Worldwide, it is the fifth leading risk of death. Cardiovascular disease is the most common complication associated with obesity. In fact, the risk for cardiovascular disease rises exponentially with BMI. Obese people are also at a high risk of developing diabetes, high cholesterol, certain cancers, psychological problems, reproductive problems, liver disease, and high blood pressure. Culture and obesity do seem to be linked. In America, African Americans and Hispanics are much more likely to develop obesity. In most developed countries, rates of obesity are higher among uneducated and those in poor socioeconomic standing. It is also important to consider the American culture. All-you-can-eat buffets, free soft drink refills, proliferation of fast food, and massive portion sizes all contribute to obesity. Assessment tools for obesity are relatively straightforward. As previously discussed, the body mass index and ideal body weight are measures used to diagnose obesity. Waist circumference is another useful measure. In-depth nutrition and lifestyle assessments can assist in developing an effective plan of care for the obese patient. Prevention is the most important step in fighting the obesity epidemic. This is especially true among school-aged children. Curriculum should include healthy eating, physical activity, and body image. School cafeterias should serve healthy food, and more time should be scheduled in the school week for physical activity. Screen time should also be limited at school. Diet is very important to promoting health among obese patients. Diets should be scientifically and nutritionally sound. Diets must also be affordable and sustainable. Novelty or fad diets often produce quick results, but people almost always gain this weight back. Exercise is another important intervention for obese patients. Low-cost or free activities such as walking are best. Many obese patients require conditioning and physical therapy for months before they're actually able to exercise effectively. In extreme cases, bariatric surgery may be required to help a person lose weight. When educating patients about obesity management, it is important to keep their expectations realistic. Losing a large amount of weight can take years. All aspects of a person's life should be considered, such as social support, emotional issues, or financial issues. In conclusion, obesity is a major problem in America. The causes of obesity are complex and multifaceted. Prevention is very important, as losing large amounts of weight is very challenging. When designing interventions, the whole patient must be taken into account.